Hello, and welcome to the UCSF School of Nursing information session for the Doctor of Nursing Practice Program, also known as the DNP. I am Dr. K.T. Waxman, Professor and Director of the program, and with me today is Dr. Annette Carley, Professor and Associate Director of the DNP program. The DNP is an academic degree that prepares innovative nursing experts to be at the top of their profession in advancing practice and policy for our complex healthcare environment. Today, during our Fireside chat, we'll review the program curriculum, practice hour requirements, and the DNP project. As you contemplate which school and which degree you hope to achieve, we will do our best to inform you of the UCSF DNP program. Dr. Carley, can you talk to us about the program curriculum and timeline of the program, please?
Absolutely. Our postmaster's program is 7 quarters in length, or 21 months, and runs throughout the year, including summers. Those entering in fall will complete their program in spring, coinciding with the school's commencement. The curriculum is a cohort model, aiming to be flexible for the working professional. Students enter and stay together as a cohort for the entire program. We're also hybrid in design and use online learning to a large extent throughout the 7 quarters. We do meet on campus 3 times over the course of the program, once at the beginning for orientation and workshops, again in the middle, and finally at the end of the program. The remaining core coursework is online. We meet once a week via Zoom for a synchronous session, typically on Wednesday evening from 7 to 8:30 p.m. Pacific Time. We use this time for small group exercises, student presentations, and other activities. It's also a chance for the student group to stay connected and interact synchronously as a learning community. Dr. Waxman, can you speak to the type of student that is attracted to our DNP program?
Absolutely. Our diverse students range from practicing APRNs such as NPs or CNSs, as well as nurse leaders with roles in teaching, informatics, administration, and management. A master's degree is required to enter the program, and we welcome nurses with non-nursing masters as well, such as MBA, MPH, MPA, or MHA. We are currently underway with our 7th student cohort, and they represent diverse backgrounds, multiple geographic regions of California and beyond, and considerable variety in practice experience. The DNP degree is an academic degree, and whether you practice in the clinical environment or in administration, we prepare the learner to be a nurse leader. In addition to core coursework, students complete an evidence-based QI project, also known as the EB-QIP. This is typically completed at their worksite. After identifying a problem through a gap analysis, this quality improvement project, which is a non-research project, uses evidence to support a change in practice. As I mentioned, this is not a research degree. So for those without an identified location for their area of interest, we are able to provide alternate opportunities. Dr. Carley, can you talk about the practice hours and hours that need to occur to get a DNP?
Sure. To be able to award the DNP degree, we must show that all students complete 1,000 practice hours. This is a requirement that's set by our accreditors. We require that applicants can demonstrate at least 240 incoming practice hours at the master's level or beyond. We can also allow for up to 650 hours to be recognized in this process. Applicants submit evidence such as transcripts and portfolio materials for consideration of these hours. Any remaining hours left to achieve that 1,000 required for degree conferral will be completed throughout the program as practicum activities. Certified APRNs typically are able to transfer in about 500 hours. Practicum builds leadership and collaborative skills, and students use these as an opportunity to be involved with professional organizations, to teach, to participate actively in local, regional, national, or even international initiatives that meet their personal and professional interests and goals. Dr. Waxman, can you speak to the program's faculty?
Sure. Our faculty are experts in their fields, and our group is comprised of DNPs, PhDs, and EDDs. Dr. Carly and I both have our DNP degree. We have expertise in women's health, pediatrics, ambulatory care, and nursing administration and executive leadership. We also have a network of non-salaried school faculty resources who assist as project team members or guest presenters in our coursework. Students are assigned a faculty advisor from the start, and we try very hard to match the student with the appropriate advisor to guide their studies. When the DNP project is about to commence, students are a key voice in determining their team chair, as well as others who participate on their project team. Dr. Carly, can you speak to what the next steps would be if someone is interested in the DNP program at UCSF?
Sure. For more information about the program, we encourage you to visit our website at this address. You will see the curriculum and course descriptions, information about program outcomes and entry expectations, and examples of student projects. The link to the online application can also be found there. You can find out more by attending one of our recurring evening webinars, where you can hear from some of the faculty and current students and have your questions answered. The schedule for these can be found on the program website as well.
We hope you will consider applying to the UCSF DNP program. We want to thank you all for joining us today.